In this video, we're going to cover the muscles of the thigh and the muscles of the leg. So we'll start off in our anterior compartment. So remember, in the leg, the anterior compartment is going to be responsible for extension at the knee, and that's in contrast to the arm, where you see the anterior compartment responsible for flexion at the elbow. So remember, the arm and the leg are just going to be opposite. Anterior compartment in the arm does flexion, anterior compartment in the leg and the thigh is going to do extension. So we'll start off in our anterior compartment. We have our quadriceps. So the quadriceps are made up of 4 muscles, hence the name quad. And so the first muscle here is the one straight down the middle. That muscle is your rectus femoris. So that's the muscle that runs straight down the middle. Then on the medial side of your rectus femoris, you have your vastus medialis. On the lateral side, you have your vastus lateralis. And then what we can't see here is the vastus intermedius, which is deep to these muscles. So those 4 muscles make up your quadriceps. Now, each of them that have the name vastus, so your vastus medialis, lateralis, and intermedius, will all attach proximally to the linea aspera of the femur, whereas the rectus femoris will attach to the ilium. So the rectus femoris attaches to the ilium, the vastus muscles will attach to the linea aspera, and then all 4 of the quadriceps meet at this common tendon here called the quadriceps tendon. And that tendon actually holds the patella bone in place at the knee. And it runs down below the patella, and it will attach here distally to the tibial tuberosity. We also have another muscle that's coming from your ilium down to the medial aspect of your tibia, and that muscle is known as the sartorius. And the sartorius, this long muscle here, that's nicknamed the Taylor's muscle. And it's nicknamed that because it allows the position of crossing your legs. So the movement I want you to know is flexion at the knee. So flexion of the leg at the knee. So you know that you have to flex your leg in order to cross your legs. So that's your sartorius. Then the only other anterior compartment that we'll need to know is down here in the leg, and that's this muscle here. So this is the tibialis anterior. And so you don't need to know the exact origin insertion, but tibialis anterior you should expect. It's going to insert or attach proximally on the tibia, and if this is the muscle that's responsible for dorsiflexion at the ankle, then it's going to attach down somewhere in the talus region, or in the tarsal region. So tibialis anterior is going to be responsible for dorsiflexion. And you can see, here's your tibia, this is the medial side, it's running down the tibia, down the anterior side of the tibia. Okay, so then we have our lateral side here, and there's only one muscle that you need to know on the lateral leg, and that's going to be your tensor fascia lata. So the tensor fascia lata, that's going to abduct, so abduct the leg. So you're taking your leg away from the midline with this tensor fascia latae. Now it's going to attach proximally to the iliac crest, so you can see here's your iliac crest, and then it's going to run down and meet with this large white band, and that's called the iliotibial tract, or band. And it's just a flat tendon that runs down the lateral side of the leg. So your tensor fascia lata is the actual short muscle that's up here that's going to be doing the AB, the abduction of the leg, and it's going to run from your iliac crest, and the tendon will fuse with this tensor, with the fascia lata that's going to be on the side. So that's the iliotibial tract. Then when we look at the middle of the leg, so the medial aspect, if you have on the lateral a muscle responsible for abduction, then you should expect on the medial you should have muscles responsible for adduction, so adduction. And so there's 3 muscles that you need to know that will adduct the thigh. So we have here, if we go from outside inward, we have our adductor longus, our gracilis, which is in the middle, and it's the longest one here. And then we have our adductor magnus. So again, we have adductor longus, gracilis, and adductor magnus. And all 3 of those are going to be responsible for adducting the thigh at the hip. So now we are going to cover our posterior compartment. So we'll start up here, the gluteus maximus. That's the muscle that's responsible for extending the leg at the hip. Extending the thigh at the hip. So your gluteus maximus extends the thigh at the hip. That's all you need to know as far as your gluteus maximus. And then we have our hamstrings. So our hamstrings are made up of 3 muscles. So we have our biceps femoris, which is going to be running down the lateral side. And you can always orient yourself from medial from lateral with this giant iliotibial tract here. So you know that's on the lateral side. So then the one right next to it should be your biceps femoris. And so your biceps femoris is going to run lateral, and then your semitendinosus and your semimembranosus run medial. So these 3 muscles, the biceps femoris, the semitendinosus, and the semimembranosus, make up the hamstrings. And the hamstrings, all of them are responsible for flexion of the leg at the knee. So you can see here this tendon that goes all the way up. That's how you know you're looking at the semitendinosus muscle, because it's going to be more tendinous in appearance than is the membranosus. So the membranosus kind of peeks out on either side of the tendinosus, and it's deep to it. So these 2 will come down attached to the medial aspect of the tibia, and then the biceps femoris will come down attached to the lateral aspect of the tibia, as well as the head of the fibula. Now, all 3 of your hamstring muscles attach proximally to the ischial tuberosity. And there's only one more muscle left. That's our gastrocnemius. So that's going to be our calf muscle. And you can see it kind of looks like it has 2 heads here. So one of these heads is going to the lateral condyle of the femur. The other one's going to the medial condyle of the femur. And then they come down, meet at a common tendon, which runs down to the calcaneus, and that's what we know more commonly as our Achilles tendon. And that completes the presentation on the thigh and the leg muscles.